I'm so happy to have both of you here, Sheila Gould and Kim Quinlan from Holyoke Community College. You both worked on a project to open up a child care center at the college. It will open next month in March. Sheila Gould, starting with you, what was the impetus for this project?
So I'll start with a bit of a story. Do you ever see those viral posts where there's a professor holding a baby while lecturing and they go viral? And what a great professor, what a beautiful thing. More professors should be like this, you know, and I get why those go viral. I get that. I want to be that person. I would hold all the babies while teaching, but it misses the real issue, which is why is it so hard for parents in higher ed to access childcare when they need it? And so that's a miss for me. While I love seeing those go viral, I think, oh, they're missing the point. They're missing the point. Why can't these parents have an amazing place where their child is nurtured and safe, but nearby? And then the parent can fully focus when they're doing whatever they need to do while accessing higher education. And then within our campus, we get a lot of emails from students. I'm going to be absent. I don't have childcare. Today was a snow day, but HCC is opened. I don't have childcare. In the spring, public schools have 2 week-long vacations, which don't align with higher ed's spring break. So that could be, if you're taking a Tuesday, Thursday course, that could be 4 absences if you don't have childcare because the public schools are closed. And that is a big loss of content. It puts you at risk for missing really important things in your class, and it impedes your ability to be successful. And on campus, as professors get these emails, it tears our heart out. You want to say yes, but you also want to do the right thing for the wider campus community. So we started to really think about this, and there was a survey done a few years ago when President Royal started our strategic plan to think about what are the barriers for students. And this continuously came up as a barrier. So President Royal was hosting some town halls where people could just openly discuss what the barriers are. So I stood up and I talk about how we really have an opportunity to look at where the child care needs are and how can we address that in a really unique way that serves our specific HCC population. You know, and that's the great thing about community college is you can tailor what you do to your actual community. So that's how it started. And President Royal was really receptive to me speaking at the town hall. And she said, write a proposal, write it up, get some data, bring it to cabinet. And Kim Quinlan helped me with the writing because I'm a better talker than a writer. And Trisha Kiefer and my late former dean, Dr. Moira McGuire, and we worked together to write a proposal. We brought it to cabinet and then COVID happened and all of our work got stalled out. So we're really glad to be at this point now.
Kim, what was some of the data that you had to put together in this proposal?
So we were looking at accessibility of childcare for students' needs for childcare, the number of professors who had stories similar to Sheila's that, you know, students were missing class because of childcare issues. And so just pulled all of that information together so that we could get a picture of sort of what the student experience at HCC was and how childcare or lack of childcare was impacting that. You know, there were plenty of students who said they didn't need full-time care for their child. It was just for the class that they needed to attend on campus or just for this short period of time. And so simply referring students out to use like a voucher at another childcare program was not meeting the need that that family needed for their child. And so that's how this sort of came to be as a good option for our campus community.
Sheila, does this come with any fees? If you're a professor, an adjunct professor also, or you're a student full-time, part-time, do you have to pay anything for the child care center to take care of your child or children?
Right now, the program is slotted to be open for students. As we take in more data about need, we're hoping to be able to open it to faculty and staff. But there is no fee during the 6-month pilot program, thanks to the earmarked money from Senator John Bayless.
Is there a limit for, so if somebody has 3 or 4 children and they're in the age group, what is the age group? It's from 12 weeks to?
We're thinking babies to age 12.
Okay.
And then in terms of limits, we're in the process of hiring a director. And once that director is on board, we're going to do a really deep dive into what times are we needed most. And hopefully, because it's run by the college, we have access to when classes are run, who is in those classes, what are their needs, so we can really tailor the hours to what is needed. And we haven't fleshed out that specificity yet, but it is coming.
We've started to gather some data, and I think we've had responses from about 80 or 90 students right now who at least are looking for more information, and like big swaths of information, morning, afternoon, you know, what time of day, what days of week would you need? And so we're starting to gather some information about that.
And because the Holyoke Community College student population is so diverse, it's very diverse,
Yeah.
then I'm assuming then whoever gets hired to run it and to be in there will have some cultural competence.
Oh, that's a priority. Absolutely. Yes, we're a Hispanic serving institution, and that's not a responsibility that we take lightly. And it was one of the big reasons that we were able to advocate for this, because the more we looked at national data, the parents that are trying to go back to school, there's a huge population of women of color who are caring for not only their children. I mean, obviously we can't serve the geriatric population, but they are caregivers for their family, caring for aging parents, caring for children. And that is a really large population of people seeking higher education or workforce development that we also offer here. So it's a really great opportunity. And it was some data that we could not ignore as a Hispanic serving institution. And it really helped propel us to keep working at this. We just have so much to offer here, and the more we can include families, HCC is a place that supports the whole learner. And it sounds a little cheesy and cliche, but we do, and we live that. And that's kind of where the name Itsy Bitsy came from. We run a Zoom
that's
cast
right.
called the Itsy.
What's the name of it? What's the name? Sorry, yeah, what's the name of it?
So the name of the program is the Itsy Bitsy Child Watch program. That name came from a Zoom cast that I do with a coach from Western Mass Strong Start Professional Development Center, Liz Charlene Tate. And we host a Zoom cast with early childhood practicum students where we talk about hot topics in the field. But the idea behind the phrase Itsy Bitsy is it's about small connections making this strong web. And that's what we wanted to continue into the mindset behind bringing this program to campus, is the more we can provide connections, we strengthen our community, not just on campus, but within our region, our catchment area.
And finally, this is my last question. What is this space going to look like? Who's designing it? And because you have your customers, to put it that way, are babies to 12-year-olds, and the needs are so different. How is that space going to be welcoming to the whole range of people who are going to be in there?
The more I think about the space and how parents perceive it, I'm really always brought back to this core value that children are more than future test takers. They are autonomous, valuable humans who deserve the most rich experience, even if it's simple supervision for a couple hours. So Kim, myself, and some other colleagues went down to the space, and we started just measuring and dreaming and envisioning, and that turned into shopping to make sure that the space really was tailored to different individual needs. You know, a cool spot to hang out for a couple hours for a preteen is much different than what a preschooler wants to play with for a few hours. So we really thought carefully about there's kind of this gradation of furniture where it goes from younger to older across a very long room. The room has a long bank of beautiful windows. And then right outside the room is a small courtyard area with a gated garden. So we're hoping to fix that up. And it's a great place for hula hoops and chalk and blowing bubbles and a picnic table. But the inside space, there is a lot of room in there for different age groups. So we really went for a neutral tone, but with pops of color. We're really aware of what can be overstimulating. So we thought of simple designs, but then made sure to order materials and activities that would be engaging in a quality, nurturing way for a variety of ages. Plus, it's a great opportunity for our education students to make activities and bring them in. We don't just have early childhood students here. We have people studying to be elementary, middle school, and high school teachers. So there's a great opportunity for them to create ideas and materials and bring them into the program.
Kim, you have something you want to add?
I was just going to say, if you put previous preschool teachers in a room and tell them to design something, you come up with magic. And so I'm really excited as the room gets built out, because there's so many beautiful elements, and children will have an amazing time, whether they're there for half an hour or 2 hours. It's going to really be, they're going to have an amazing time while they're there.